Today we're going to be discussing the Nomad Pro, proper care and maintenance in regards to disinfecting. We received an update by manufacturers that many offices, owners, and operators are still not following the manufacturer recommended cleaning and maintenance procedures in regards to the Nomad use and care. Improper cleaning of the device can lead to liquid ingress into the handset, and if that comes into contact with the battery pack, it can then lead to malfunction, which include and are not limited to short circuits due to the liquid ingress into the internal circuit board, overheating, smoking, melting, and surrounding material can also be damaged if in contact with the handset at the time of the malfunction. This then all leads to the Nomad becoming unusable. As we know, we're going to clean the Nomad between each patient. We're going to use a non-acetone-based disinfectant wipe to disinfect the exterior surfaces. If you're using the wipes that are self-made, such as the 4x4 gauze submerged into disinfectant liquid, we're going to squeeze those out completely so that no extra liquid is dripping before using them. We're going to use the wipe according to the manufacturer's recommendations, which we'll find on the next slide. And then we're going to wipe down all exterior surfaces of the Nomad handheld X-ray unit. So the manufacturer recommends Cavicide, which many of us are already using. There are two types of Cavicide, so when you're ordering, we want to make sure to order the one with no acetone and 17% or less alcohol. You will see what I'm talking about pictured there on the left. It's available in the spray, liquid, and white formats. So as we just stated, there is a spray form. We can use the spray form, but we want to make sure to spray the solution onto a paper towel before wiping the Nomad. We're going to make sure the towel is not dripping to ensure that no moisture seeps into the Nomad. And we're not going to spray it directly onto the Nomad, the handsets, or even the power supply. As a side note, the Nomad, the handsets, and the charging cradle, as well as the AC power supply, are not designed to be subjected to any kind of sterilization procedure, such as an autoclave. You can also use the anti-contamination bag if you feel that's what you like to use. It is up to the operator preference, but you'd use like a clear barrier cover that you use for your chair or your trays. Go ahead and put that over the unit and use as you like. Otherwise, just use the wipe down method, what we talked about prior, again, wiping all exterior surfaces. A little other side note is the charging cradle. Before we wipe that down, we're going to unplug the charging cradle. And we want to maintain good sanitation practices when handling the unit at all times. Keep in mind that even when you're using gloved hands, you're both inserting and retrieving the image receptors from your patient, and then likely coming into contact with the Nomad. We want to maintain good sanitation practices when handling the Nomad.